Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. Time for part 2 of the weekly update, the numbers. We are a week past Thanksgiving now, and the summary is cases are shooting up all over. Just like last year, North Carolina and much of western North Carolina back in the red. So please share this with everyone you care about. Across the country, Northwest looks less red, but the upper Midwest and Northeast solidly in the red zones and creeping into the Southeast. New Hampshire and Michigan, now with the highest rates in the country, both above the 100 per 100,000 population threshold. 36 states now in the red zone, many well above the 25 per 100,000 population threshold, and only 3 states still in the yellow. Each of those has seen an increase over the past 2 weeks. For our neighbors, Tennessee back in the red, and notice all the red in East Tennessee adjacent to western North Carolina. South Carolina, more orange, and Georgia, the 5th lowest rate in the country, even though with their increases, they're back up into the orange zone. North Carolina, also back up into the red zone, 56 counties, more than half the state, back in the red, only 4 still in yellow. And note the marked increases in cases this week. Also note that deaths remain lower, but again, that's a lagging effect. As far as western North Carolina, 2 weeks ago, there was just 1 county in the red, after several weeks with none. Now 7 of the 11 counties back into the red, in fact swaying with the highest rate in the state this week. There are some significant increases for others, as you can see. Only Macon and Clay saw a decrease over this time. Testing, North Carolina above 5% threshold, 5 counties still below that threshold, but note 2 are back above 10%, one of those being Haywood County. And speaking of Haywood County, total for the pandemic is now at 7,939. That's an increase in the past week of 140 new cases, the largest weekly increase since early October. At that time, we were coming down from a surge. Now we're on our way up. But note also that we are not yet seeing exponential spread. Not yet, anyway. Deaths, 2 additional added for a total of 154 for the pandemic. November this year, we have seen about as many deaths as November last year, and we know what followed that. Also, as mentioned in Part 1, Haywood Regional Medical Center with a significant uptick in COVID-related admissions, and they continue to have some of our fellow residents in the ICU and on ventilators. It should be mentioned that the majority of admissions seem to be in the 30 to 60 age range, and overwhelmingly folks who have not been vaccinated. As you can see here, cases in the UK continue to go up. This mirrors what's happening across all of Europe. Each increase starting from a higher baseline in their experience, something we can also see here in our own case curve. So looking at the data and reflecting on the criteria to judge the coming winter, at this point it is looking more and more like deja vu all over again. We aren't seeing exponential spread yet, but the next couple of weeks are a critical time to see if we go there. In Haywood County, with over half of our county residents vaccinated, and many more having recovered with some degree of immunity, this may blunt the rise in cases we see, or there may be enough people unprotected to fuel the same kind of surge we saw last winter. The good news, if you have immune protection, and if you continue to be careful when you go out and about, and those around you are protected and careful, the risk of getting infected is really low. And the chance of a bad outcome, even if you do get infected, is really, really low. In fact, if vaccinated, you have a 10 times greater protection from death if you were to get infected. And if this is you, enjoy all the holiday time knowing you have done what you can to be safer. The bad news, for those of you without protection, the virus, in whatever form it takes, is coming for you. Please consider carefully if that is worth it to you and those you care about. If you think you have protection but have never been vaccinated, or can't be sure you were infected, meaning you never got tested, please consider carefully. You may well be more vulnerable than you think. So heading into this surge, set yourself up to stay well. If you've enjoyed a bit of time letting your guard down with lower case rates over the past few weeks, now's the time to pivot back to being super careful. Whatever you were doing last winter, you should be doing now. So go back and see video 188 for how to do a safer holiday dance with your family and friends. And if vaccinated, get a booster. If more than 6 months after your infection, get a booster. If your kids are eligible, get them vaccinated so they and everyone around them is safer. And if you have concerns about this, talk with your doctor or the health department or me about the concerns you are hearing. There are, unfortunately, those who will only tell you there's only one side of this story, only risks and no benefits. It's likely they don't really have you or your child's safety truly in mind, or they themselves aren't able to balance risk and benefit very well. Be careful, get the full picture. And if you're not vaccinated, well, is that really your best chance to remain well? So be well and be careful, especially right now.